The experience that I've had with Focused Ultrasound has been fantastic, and we're really at the start of this journey in veterinary medicine. My hope is in 5 years that veterinary medicine recognizes that Focused Ultrasound is a remarkable tool when it comes to the treatment of a wide variety of diseases, including cancer and many others.
Welcome to Curing with Sound, a podcast presented by the Focused Ultrasound Foundation. I'm your host, Allison Preston Smith. Focused Ultrasound holds immense promise for the veterinary field, and Dr. Philip Bergman, director of the Focused Ultrasound Foundation's Veterinary Program, is advancing this unique bench-to-bedside to kennel cycle where clinical insights from animals help accelerate human therapies and human breakthroughs inspire new treatment options for our pets. An expert in veterinary oncology, Dr. Bergman served as Director of Clinical Studies for VCA Animal Hospitals from 2011 to 2023 and as Global Director for Mars Veterinary Health in 2024. He was also previously Chief Medical Officer for Bright Heart Veterinary Centers and the head of the Donaldson Atwood Cancer Center at the Animal Medical Center in New York. Dr. Bergman is the principal veterinary investigator for the fully licensed canine melanoma vaccine, ONCEPT, and serves as adjunct faculty at Memorial Sloan Kettering Cancer Center. He is board certified in veterinary medical oncology by the DACVIM, completed his PhD in human cancer biology at MD Anderson Cancer Center, and has held leadership roles in both clinical studies and academic medicine. Welcome to the podcast, Phil.
Thank you so much for having me. I've been looking forward to this.
What first drew you to veterinary oncology?
Oh, wow. Well, I've known since I was a little kid that I was going to be a veterinarian. That was just always the focus. I didn't particularly know exactly what that was going to be like. Leading up to vet school, my family is a German dairy type cow family up in Wisconsin. And so I sort of had this vision in my head that I was going to be a dairy practitioner. But then I had some mentors at Colorado State where I did my vet school training in the late 80s. And they were, like many really good mentors, they had profound impact on me. And it was there that I got turned on to oncology. And also had a grandfather that was dying of metastatic prostate cancer at the time. And they all kind of came together at one time. And I said, I think I'm going to do veterinary oncology.
Over your career, you've held multiple leadership roles, and one of your most significant achievements is your work on ONCEPT, the canine melanoma DNA vaccine. Can you explain what ONCEPT is and why it was so groundbreaking?
Got invited to basically a party in New York City where the leadership at the Animal Medical Center in New York City was trying to create relationships and collaborations with folks at Sloan Kettering. But I remember at that party, a person came up to me by the name of Jed Wolchuk, who's a luminary in cancer immunotherapy. He asked me, and I'll forever remember this, do dogs get melanoma? And I said, yeah, why are you asking? And he said, well, I've got this vaccine I'm working on. It's been really successful in mice, but I know it's 10, 20 years away from being able to be done in people. And I see veterinary medicine as a potential important bridge that could benefit dogs, but then also turn around and benefit people. And so the idea that Jed and his team had at Sloan Kettering and was working on a patent towards that was to utilize different species DNA to wake up that immune system. So we then realized that because we were going to concentrate on tyrosinase, which is the rate-limiting enzyme in the melanosome that makes black pigment. So we were, if we gave a dog tyrosinase, the dog could care less because it's from self, so they don't make an immune response to it. And so we made the decision early on to, from a development perspective, to utilize human tyrosinase for all veterinary species because that would be xenogeneic or a different species utilizing human. And it's worked out incredibly well because we showed both safety and efficacy in dogs And we've now shown that in horses. We've shown it in cats. Every species that we've tried it on, including a variety of exotic types of species, has shown an immune response and then a prolongation and survival associated with that.
And this leads into this idea of One Health and how animal research can benefit human patients and vice versa. Can you explain the idea of One Health?
Yeah, we call it one medicine in my world, but essentially the terms are synonymous: one health, one medicine. And what it really speaks to is that a lot of the same diseases that humans get, well, dogs and cats and other veterinary species get as well. And we've been saying for 30 plus years in veterinary oncology that when it comes to model systems, mice have their limitations. There are a lot of things that you can learn that are good from mice, but they don't develop typically spontaneous disease like you and I do. And so the dogs and cats that live with us have intact immune systems. They sometimes eat the same foods that we eat. They're in the same environment. And then they spontaneously develop these variety of diseases, including cancer, that very much better recapitulate the human condition. And that way we can better both those veterinary patients' outcomes as well as then turn around and impact the human side. So it's kind of a constant funnel point where both sides inform each other, hence why the term of one medicine.
What are some examples of clinical trials that are using focused ultrasound to help animals with complex diseases and conditions?
The experience that I've had with focused ultrasound has been fantastic. And, we're really at the start of this journey in veterinary medicine. And some of the things that are being done by various Focused Ultrasound Foundation investigators that are funded by the foundation, they're doing some really remarkable stuff. So ongoing, there's some really cool work related to osteosarcoma with Dr. Tui. And I know she's had a podcast with you guys very recently, which was fantastic. And where I think the beauty of that is that work, I'm hoping in the next 3 to 5 years will actually translate into a minimally invasive or non-invasive treatment for dogs with osteosarcoma that also could have profound implications related to the dog being able to keep its limb, because currently the standard of care is a limb amputation. So definitely has impact on quality of life and quality of life for the owner, et cetera. And I think, wouldn't it be really cool if we could have a non-invasive thing such as focused ultrasound that both treats the local tumor and then induces immune effects that then prevent the metastases from growing from there. One, it saves owners tremendous amount of cost, tremendous aspects related to side effects. So that's just one potential indication. There's another one that's ongoing with lipoma. And I don't think of lipomas as a particularly devastating, clinical aspect, but there are times where lipomas get so big that we can't remove them surgically. But having an ability to actually then treat that lipoma with focused ultrasound where it's non-invasive, then prevents some of those potential surgeries that we have to do later. But it's really the sky's the limit when it comes to thinking about what we can potentially do there. So there's a study at Auburn that we have funded related to diabetes in fat cats. And can we potentially impact that? And then certainly other investigators are looking at a variety of different other tumor types that seem to recapitulate some of the approaches that are being used on the human side, such as glioblastoma and other types of tumors. So again, it's really up to us to try to figure out what we think those best indications are and trying to figure out what's the lowest hanging fruit to be successful in the future.
In 5 to 10 years, what progress do you hope to see in the veterinary field when it comes to focused ultrasound?
My hope is in 5 years that veterinary medicine, one, recognizes that focused ultrasound is a remarkable tool when it comes to the treatment of a wide variety of diseases, including cancer and many others. And so the hope there is that we have veterinary-specific focused ultrasound machines that are in place at the majority of the large 24/7 ER specialty centers that are in private practice, as well as those that are at veterinary teaching hospitals that are associated with training institutions. And then my hope is from year 5 to year 10 that we then start to see that this remarkable technology has an ability to start becoming utilized in primary care veterinary settings. So that way they don't have to be referred to a 24/7 specialty ER type of center.
And what kinds of treatments or clinical uses do you envision being available to pet owners?
Yeah, so again, a lot of the focus currently is on brain tumors, bone tumors such as osteosarcoma. I have a significant interest in trying to move this forward in cats that are hyperthyroid because this is a really common phenomenon that we see in veterinary medicine where it's often a 12, 14, 16-year-old cat starts to unfortunately they start losing weight. They start becoming manic because they have a really high thyroid level. And it's because they have a benign tumor that's sitting in their neck. And so currently the standard of care is we either surgically take it out, so invasive, or we give them radioiodine to then ablate that tumor. The problem there is they're away from their owners for 2 weeks, so they're stuck in a cage while they decontaminate. Another potential option is an iodine-free diet, which does exist, but the problem is you can't give treats that have any iodine in them, and it's an expensive type of diet. So wouldn't it be incredibly cool if we could then, in an outpatient setting, treat this little tiny adenoma that's causing so much havoc in that cat and do that with focused ultrasound?
What would you say are some of the biggest challenges for using focused ultrasound in animals?
Yeah, it's a great question. The real rate limiting step to this is the machine. And what that really means is that we've got a number of FDA approved machines on the human side. The problem is they're extremely expensive. They're usually $1 million on up, and that doesn't work in veterinary medicine. Just from a financial perspective. So one of the things that we are hyper focused on currently is figuring out which companies can potentially then arm us with a veterinary specific machine that is a lot less costly. And one of the advantages that we have in veterinary medicine is that the regulatory pathway for getting a machine approved in veterinary medicine is really more about registering it and making sure that its electrical safety is appropriate, getting a CE mark. So you don't need to have the efficacy studies to then start selling or commercializing those types of machines. The good part is it greatly reduces that cost. It greatly reduces the potential development time that it takes, since those trials typically are randomized and very expensive and take a long time to do. And so the trick will then be is finding that, those right couple companies that want to do this. So we've actually come up with a veterinary dream footprint. So we then share that with those companies, and we utilize Cindy through Fuss Partners to try to develop those types of relationships. And so we lay out for them, these are the things that we think are the perfect aspects for a veterinary dream machine in focused ultrasound. And now our job is to then, which is really what we've been doing over the last couple months, is proffering those types of relationships with those companies, but then hooking them up with the veterinary specialists that are in their area. And what we're really trying to do is, again, make a foundation for those groups to work together to then really start to put a letter of intent into the foundation. And if we like that idea, then we move that forward to a full proposal that we then consider for funding.
What would you tell listeners about focused ultrasound and its potential use in treatment for their pets?
Yeah, I see this as very commonplace in the future. The problem right now is that there's relatively smaller numbers of investigators that are doing that type of work. So I encourage folks to spend some time on the website, and we actually talk about some of the studies that we have ongoing. And one of my other goals from both a short-term and a long-term goal is that currently, if you're a person that has a certain disease, you can actually go on the FUS Foundation website, as you know, and plug in whatever disease that you have, and then where you live, and it'll then actually tell you these are then potentially some of the sites. So I've actually done this with a couple friends with Parkinson's disease and other types of diseases. And it's really easy to get on the website and go figure that out. And it tells you these are the 8 or 10 sites across the world that do these either one studies or it's already been commercialized. So you can then go have that procedure done. My goal is that we have that same exact type of situation where a client on the veterinary side can actually plug in their pet's information, and then it spits back out to them. These are the sites that are doing either studies or potentially have already commercialized it. The dilemma we have is that these are all investigational studies currently, so we don't have anything commercialized yet on the veterinary side. But I'm predicting in, 3 to 5 years that we'll have that.
For young veterinarians or veterinary researchers who are interested in oncology or new technologies like FUS, what advice would you give them?
I would first share with them, don't give up. One of the things that's hard in veterinary medicine that I think a lot of people don't realize until they're really into it is, the average debt load that a veterinary student takes on now is around $250,000 to $300,000. And so, in veterinary medicine, we know we're not doing this for the money. We're doing this because we want to really impact outcomes for pets and their owners. So first advice is, if this is really in your heart to do this, don't give up because of some of those reasons. Secondarily, if you're interested in these sort of specialties or thinking about focused ultrasound, it's so easy now compared to 30 years ago to get information. That said, you need good mentors. I think about, we talked earlier about, what profound directions that they can make. One of my mentors previously was Greg McEwen, who's one of the grandfathers of veterinary medical oncology. And he happened to be doing a sabbatic at MD Anderson when I was there. So he was a lab next to mine. And he was the one that actually told me, Phil, you need to go to New York City because that's where Sloan Kettering is. And that's where AMC is. And you'll be able to do things there that you'll never get to do anywhere else. And he was spot on. So mentors, find good mentors and run with them. And a lot of times those folks are in those positions because they want to give back to the profession that's done so much for them.
And finally, can you tell us about your pets?
So this is our dog, Welly.
Oh,
she's a COVID rescue. She's a mutt. We love her dearly. She's now 6.5, 7. And then we had 3 cats previously. We've lost 2 in the last couple of years, of course, to cancer, because I'm an oncologist. Of course, that's going to happen. So we have 1 cat left, which is a beautiful black long-haired cat. We adopted her because we knew that no one else would adopt her because people don't like black cats for stupid reasons. And so she's now 17, starting to show some age, but a tremendously beautiful cat. And she thinks that Welly is her mom or her dad.
Oh, that's so sweet.
So Welly tolerates her.
Oh, well, thank you so much, Phil. It's been so great talking to you. We're so glad to have you here at the foundation.
Thank you so much. I appreciate it.
This episode of Curing with Sound has been presented by the Focused Ultrasound Foundation. If you'd like to learn more about Focused Ultrasound or the foundation, visit our website at fusfoundation.org. You can also sign up for our newsletter and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information about Focused Ultrasound. You can also rate and review the show.